I work at a hospital where our motto is your birth, your way. And we really try to do that. So we do things like allowing music, allowing people to labor in beds or the tub or walk. We have telemetry if they have to be monitored. People can go unmedicated. My nurses are all trained in natural birthing techniques. And so for me, that is the optimal place to deliver, where you can be empowered and have everything that you want, but still have that backup for anything that might go wrong. To me, the best scenario would be if you could deliver in a hospital that still gave you the comforts of home. So when I'm trying to set up a women's center or birthing center, the very best thing for me would be to have a setting where people could feel comfortable with the interventions they wanted and declining the interventions they didn't, but still having all the optimal safety of monitoring, of a C-section area and room, surgical techniques if needed, neonatal resuscitation if needed, NICU support if needed. Otherwise, you don't have to do them, and they're just there in the background, and you never even know that it's something that's there. We get many transfers from birthing centers and from home deliveries, and many of these have to do with hemorrhaging after birth or maybe hemorrhaging during birth. And without medications and equipment availability in the birthing centers and in people's homes, they have a higher risk of having fetal distress as well as maternal complications. Whereas when you are in a hospital, you have the option to have blood transfusions, medications available to stop hemorrhaging. We know as nurses that about 90% of all births are going to go well, and they don't really need us as nurses to intervene or do anything. However, there is always the 10%, and you're gambling that you won't be that 10%. And so for me, when it comes to my baby, I don't want any gamble. I want to be in a place where if I am one of those people that are in that 10%, I have people there that are immediately available to help me, not 10 or 15 minutes away.